much for coming. We're really delighted to welcome you to this launch of a very exciting new initiative here at Drexel University called the Drexel University Center for Climate Change and Urban Health Research.
Awesome.
Yeah. We're really thrilled, and we want to tell you about it and talk about how everybody can be engaged. And we have a lot of people to thank. First of all, I'm going to turn it over to our dean, Gina Lavasi, who's going to say a few words, and then move on to Alistair Saunders, who will Senior Vice Provost for Research. Did I get that right, Alistair? Well, we'll also say a few words. Thank you so much, and then we'll get started with the program.
Well, thank you so much for the opportunity to be here today. I was thinking about, in preparation for this event, one of my first jobs that I had as a summer job in college, where I was going door to door raising money for an environmental organization. And doing that work in mild Southern California brings back memories of those mild winters, mild summers throughout the year. When we have an early spring like we're having now, today on our first day of spring, I think we already have so many of our flowers blooming. I think of the comfort of those California temperatures, but I know that many of us also see that warmth with a sense of foreboding. So even when we have the beauty and the comfort of milder temperatures earlier in the year, we're worried about what it shows for our future. I know that attention to climate change and the impact on health is not new to our school or to the university at this time. Certainly urban health is also not new to either, but this center that's at the intersection has such great potential to elevate the capacities that we have in our school and across the university, as well as the aspiration to make sure that we are strong partners in helping to make sure that the future is beautiful and that we have the data to make wise decisions to be good stewards for the resources we have. So I want to just congratulate the 10 directors and thank you for your time.
Thank you, Gina. Thank you so much. Lovely flowers. Alistair?
Good afternoon, everyone. First of all, congratulations. It's a wonderful accomplishment. We're so excited to support this effort. You know, as an institution that sort of prides itself as addressing societal challenges through translational research, this is another example of that. This aligns directly with what we're doing as an institution and our strategic plan, our areas of excellence and opportunity, sustainability, equity, and it's those intersections and the interdisciplinarity of that really offers great opportunity. And on top of that, partnerships. This is built on partnerships, and partnerships are so important. So I just want to add my congratulations on behalf of the university leadership. Another example of tremendous interdisciplinary research that's going to improve people's lives. Congratulations to the team, and can't wait to see what comes out of it. Thank you.
Thank you so much, Alistair, for coming and for all your support of this initiative. So we have a program, a short program to tell you a little bit about what we're planning. And we'll spend some time at the end having some conversation about other opportunities that you may see. And then we have a little reception, so please stay and join us for that. So as you can see here, I'm going to start us off, and I'm speaking on behalf of a large team, which I'll tell you a little bit more about. Maybe I should work now. Oh, good. Okay. So this is our agenda. We already started. So first of all, I just wanted to say a few words about sort of the motivation for this initiative and provide a little bit of an overview of the big picture aims. The first thing that we wanted to highlight is just remind everyone that this is part of actually a large NIH initiative on climate change and health, which is relatively new. NIH is a little bit of a latecomer to this, but they got on the train in time, so that's good. And you can see sort of a framework that they are using. And I'm not going to go into the details of this, but we are one of 5 initially funded P20 centers. P20 are exploratory centers. I'll tell you a little bit more about what that means. We were funded in the first round. These are sort of the 4 other centers that were funded together with us. There's a continuing competition for an additional set of centers that is under review right now, and it's highly competitive from what we understand. There are other pieces to this NIH climate initiative. There's a coordinating center, which is coordinating all these activities based at Boston University and Harvard, which we've already interacted with and in fact participated in a very large virtual meeting that they organized. And then there's also a piece that's about community engagement on climate and health equity. And these were very recently funded. So these are other opportunities. So this is really part of a larger initiative, and it's important to remember this as we move forward. So our focus, of course, is on urban health. And why focus on climate change and urban health? Well, this is not going to be news to many of you, but obviously urban environments growing worldwide and have a major impact on climate change because over 70% of global energy-related carbon is emitted in cities. But there's also a lot of opportunity for mitigation through urban policies. Urban areas are also very vulnerable to the adverse health effects of climate change for many reasons, including geographic location, poor planning, high density, inadequate housing, poor infrastructure, and also very high levels of inequality. So also opportunities for adaptation policies to mitigate I shouldn't say mitigate because mitigate is used for a different thing in this climate context, but to buffer the adverse effects of climate change. And then of course, urban policies can support both things and have environmental and health co-benefits, which is something that's talked a lot about. So this is why we're focusing on cities. And really our ultimate goal is the creation, translation, and dissemination of evidence that will support urban policies to address the health and equity impacts of climate change in cities. That's what we're aiming for in the long run. This is an exploratory center. So the objective is to build capacity to be able to take this to the next level. And so interdisciplinary and multi-methods approach, strong equity focus, global reach, and engagement with policymakers and communities to maximize solutions. So these are all things that you'll see woven into the center. But the first step is to build capacity for this research and policy and community engagement here at Drexel. And we start with our strength in urban health and health equity at the Urban Health Collaborative at the Dorset School of Public Health. But we add on a bunch of other things that are very important: climate sciences, environmental health, research capacity building, community engagement, urban policy and practice. So really it's about that intersection that we can leverage here at Drexel to really make us one of the leading places working on the impacts, solutions for the impact of climate change on urban health. And one way we're going to do this, which also builds on other work that we have and other work that's ongoing here at Drexel, is leveraging the power of cross-city comparisons. And we're doing that on one hand, building on our US-based work at the Urban Health Collaborative, which includes a bunch of activities that we do in partnership with our local health department here in Philadelphia. We also have an ongoing partnership with the Big Cities Health Coalition, which brings together the health departments of the 35 biggest cities in the US. And also our global health work in Latin America through the Salubal study, which was just refunded by the Wellcome Trust with a climate change and health focus. So our aspiration is to create evidence to support action on climate change and urban health across the Americas. That's our aspiration. The center itself has 4 cores, which we'll tell you a little bit about. An administrative core, which Usama will talk about, a research project, which is a bit of a demonstration project, because this is the goal of this center is primarily to build capacity, use the research project to launch a series of activities that can grow into other things. A research capacity building core, which you'll also hear about from Risa, and a community engagement core, which you'll hear about from Mariana. And I also want to highlight our partners, because this is a partnership between Drexel and several institutions in Latin America who are key contributors to this work, and without whom we could not do this work. That includes INCAP, Instituto de Nutrición de Centroamérica y Panamá in Guatemala, Fernanda Crocker and Mónica Mazariegos, some of them may be online. Universidad of São Paulo in Brazil, Nelson Gouveia, FIOCRUZ, Fundación Oswaldo Cruz in Rio de Janeiro in Brazil, Fátima Pina, and Universidad Federal de Minas Gerais in Belo Horizonte, Brazil, Valesca Caiafa and Guta Friche. And also Berkeley, the Institute for Transportation Studies at Berkeley, with our longtime collaborator, Daniel Rodriguez and his team. So here are pictures, here are their pictures. So we're very, very grateful to all of them. Forgot to mention Maria as a co-investigator at Berkeley, to all for their partnership and their work on this. So I think with that overview, I'll turn it over to Usama, who will tell us a little bit more about the administrative core.
Thank you, Anna. As Anna said, the center is composed of 4 cores: administrative, research project, research capacity building core, and community engagement core. The main goal of the administrative core, which Anna and I co-lead, is mostly to create the organizational structure for the rest of the center to run and create a series of cross-cutting activities across the center. That includes coordinating center activities. Center is a structure around an executive committee made up of the core leads and site PIs. We also have an external advisory board that we'll introduce in a minute. The community engagement core will be talking about their policy and community engagement board, and we have the 3 cores that we mentioned a minute ago. As part of this, as we said, we are convening an external advisory board here. We have so far 3 people that have recently accepted being part of this. And then I was Asiem from Columbia here in the audience. Thank you, Anna. Jonathan Paz from University of Wisconsin-Madison, and Catherine Ton from East Global in Barcelona. We are aiming to have 2 more people here, and these people are going to help guide the direction of this center so we can achieve our objectives. The second aim of the administrative core is to enhance diverse perspectives and ensure that this diversity actually help us go beyond what our initial objectives were. As part of this, we wrote a plan that we are now using to consider equity and diversity both in the selection of the leadership, so the executive advisory board and the executive committee, but also importantly in other center activities, webinars, invited speakers, the review of pilots, etc. And the idea here is to take diversity very, very broadly, both in terms of underrepresented groups, but also early stage investigators, gender, people from low and middle income countries, etc. We are developing also, which we'll talk in a minute about, a series of evaluation metrics and a system to track all of these evaluation metrics, and a lot of them have equity at their core. So in order to be able to track all of this and to do the work of the research project that I'll mention in a minute, another aim of the administrative core, and it was part of the mandate of NIH, was to provide this, was to create a robust data infrastructure. And I think this is something that NIH in general is realizing of the importance more and more, I think especially in fields such as public health, where we generate a lot of data. And as part of this, we are proposing 3 things. The first one is to create a data infrastructure for the research project that will follow FAIR principles. So FAIR principles are this idea that your data should be findable. It shouldn't be, you have to go looking for it. It should be somewhere where you can find it. It should be accessible. Not only you can find it, but you can actually access it. And you should be able to work with it with your own data, so it should be able to match what you have in your own data, and you should be able to reduce it. We are also creating an administrative infrastructure that will facilitate the reporting of metrics, and then all of these will be actually integrated in a platform that will allow us to do data sharing, sharing of products, sharing of metrics, etc. Now, the fourth aim of the center is actually to set the agenda on the field of climate change and urban health and health equity. And part of this includes creating an invited speaker series where we'll bring people to Drexel to tell us about their work. We actually already had one last November, Tariq Ben Marnia from Scripps in San Diego, who gave a great presentation here. If anyone is interested in watching that presentation, there is the link here. Now, in June, in a couple of months, we have Kai Chen from Yale University coming to present his work. And then in the fall, there's TBD Jet, Ricardo Castillo from the University of Pennsylvania, next door, and Anu Ramaswamy from Princeton University. As you can see, we've also selected people with very different topics, but we are trying to capture a diversity of work that is happening in the climate space. But not only invited speakers, we are also organizing a monthly webinar series. We've actually already had the first one by Mark Nieuwenhausen from East Global in Barcelona, where he presented some of his work on making cities and the built environment carbon neutral and healthy. You can also watch his presentation there. And then on April 10th, we'll have Marianti Kiomor. I'm sorry, that's hard to do this. But we'll have a great researcher. Okay, sorry about that. On April 10th, coming to tell us about very interesting work about heat and the impact, especially very short-term impacts of heat on New York State residents. You can register for that in this link here. And then, as you can see, we have other people line up to come both from Latin America and from here in the US, even locally. Franco Montalto is here in the audience, will be presented to us in October. Okay, so as Anna showed before, the center is made up of these 4 cores. We are going to now present the 3 of the cores that are going to be doing a lot of the work of this center. We'll start with the research project, and Brice and Fernanda Crocker, I believe, will present the research capacity building core, and Mariana will present the community engagement core. So with regards with the research project, the idea of this research project is to demonstrate that the feasibility of doing policy relevant work in the climate and urban health arena, with a big focus on health equity and a big focus on cross-city comparisons. And we are going to be engaging researchers from both the US, Central and South America. And the key goal of this project is to essentially explore variability in the effects of heat on mortality by neighborhood. We know that climate change doesn't impact everyone equally, and we think that a lot of that variability may come actually from neighborhood level factors that may contribute to that variability, but also some of that may come from individual level factors. We are going to be doing this work in 5 cities. It's going to be here in Philadelphia, Guatemala City in Guatemala, Panama City in Panama, Rio de Janeiro in Brazil, and São Paulo in Brazil too. And this framework, a lot here, but it kind of summarizes what we want to do here. We want to see how those effects, broader area effects of temperature, affect mortality down here. And we want to see how much of that happens because different neighborhoods are exposed to different temperatures. Like if you've ever walked in the summer on the street and there is no tree, clearly have felt that. But also because there are social factors and individual level characteristics that may affect how people are impacted by that heat. And some of the examples of the things we want to do with this project are to see, as I said before, how different are the effects of heat on mortality by neighborhood. This could actually help us target specific interventions to specific neighborhoods. We know there is a neighborhood where the effect of heat is much stronger, then all of those interventions that may happen in the summer, that maybe citywide interventions could be targeted for those areas. We also want to see, as I said, what neighborhood level factors are explaining this variability, especially policy relevant ones. Because if we can intervene on those, then we may be able to, and again, I was going to use the word mitigate, but that's not the right word here, we may be able to buffer what the effects of heat may be on the health of people in those areas. But also understanding individual level social factors such as race, ethnicity, or education, which may also help with similar efforts. And importantly, and this is where the cross-city comparison comes, we want to see if this varies by city or by country. And a key part here is that different cities and different countries have different segregation patterns. The typical segregation pattern we observe in the US may actually not be the same in Panama, in Guatemala, or in Brazil, which means that some of the patterns with urbanization we see in the US and we take for granted everywhere may actually not apply in other places. This may actually give us hints on that, so we can have interventions that are more locally tailored. And we want to see whether those factors actually are similarly impactful. The neighborhood level and individual level factors are similarly impactful. And last, try to see whether those differential effects that we are talking about are because neighborhoods have different temperatures or because the people living there actually have suffered different effects of heat. We want to separate that in order to be able to know what are the best targets here. So we target the neighborhoods, so we target people, so we target both. What do we want to do there? And this is some of the things we've been working on. We hope to have some results to show over the next year of work here. And I'll pass it over to Lisa.
Thank you. So I have the pleasure of leading the Research Capacity Building Core in conjunction with Fernanda Crocker at INCAP. And this core is, as the name implies, the main goal is to increase our capacity as urban health researchers to conduct research on climate change and health, and to collaborate with climate scientists to conduct this research. So it's both increasing the capacity of urban health researchers to conduct this research, but also bring in climate scientists and scientists who have not yet engaged in this area into this intersection of climate change and urban health. And we plan to do this through 3 interrelated aims, including things that you might expect, like workshops and webinars, journal clubs, also by developing methods. For example, some of the project that Osama described needs development of analytic methods to carry out the work. And then also supporting the development of transdisciplinary projects. We'll hear a little bit about that in a moment. Here, I want to emphasize the idea of transdisciplinarity, involving not only multiple disciplines, but really meaningful engagement with communities. And that involves training researchers to do that meaningful engagement with communities here, as communities meaning inclusion of policymakers and also the community at large. Our ultimate goal, the larger vision of this capacity building core, is to create a community of urban health and climate change researchers across the Americas by helping us build our methods toolkit, to have access to climate data, grow our collaboration skills, including our ability to conduct transdisciplinary research, bring new people to this area of research, and also create opportunities for grant writing and training on grant writing.
Hi, everybody. I'm Fernanda Crocker, based in Guatemala. So we have a series of very exciting activities for this core. And actually, we have an announcement. It's a call for pilot projects grants. So this grant is up to 20,000 or 30,000 if there is a policy community engagement component. The goal of this project, pilot project grants, is to develop preliminary data and research on the impact of climate change on health in cities, to support the submission of larger transdisciplinary research projects afterwards. So we are encouraging to apply to all investigators associated with CCUH, and also Salurba climate institutions. We also encourage you to apply to those on early stage or mid-career researchers. And it's pretty soon, it's next month, the due date. So please, if you want more information, there's a link here when you can access to all the details and all the goals, and also there's a template of what we are expecting in terms of words and size of the grant. So it's very detailed. So it's also part of the capacity building component that we want to give very specific details on how to write a pilot grant, right? So this is very exciting. You can also reach Brisa and me and also Kayla if you want more information about this. Next, please. Also, there are other activities as the Climate and Health Journal Club. This is actually an ongoing activity. This is a discussion around published work on climate health and health, climate change and health. It's led by different trainee or staff or faculty each month. It happens every third Wednesday. And now it's open to everybody who is associated with CCUH, Drexel, or Salurba Climate, and it's available on Zoom as well. It's very important for us because we can reach out the community in low middle income countries, the community in Latin America. It's invited to join these important discussions. So also there's another activity that we are about to launching in April. And it's going to happen the second and the fourth Thursday, 2 p.m. East. Is a learning community when we want to read online course materials that are already available online. But the idea is to gather and participate in group discussions. So yeah, if you want more information about this, you can expect an email pretty soon with more details about it. Next.
So some of our other ongoing training activities are upcoming. This summer, we will have a hybrid workshop that is now a concentrated 1 week workshop. Will be run by Josiah Kephart in the audience. We'll also have a data and methods workshop in the fall that will focus more on statistical methods and analysis approaches. We're looking out for all of the trainees who are interested in joining this area, and trainees speaking broadly because some of us are new. So despite being experienced investigators new to this area, to support the ongoing work, translation of methods, developing proposals, we'll have office hours as part of the research capacity building core, and we will have a grant writing boot camp in year 3 of the grant. So handing it over to Ariana.
Thank you. Okay, thank you. So I'm Mariana Lazo, and it's my pleasure to lead the community engagement core of this center. This core has the goal is to increase the impact of our research by engaging policymakers and impacted urban communities to inform future research questions, and to drive meaningful dissemination and engagement efforts. In order to achieve that goal, we set out 4 aims. First one is the focus on ensuring that our activities are guided by the feedback from policy and community stakeholders. In aim 2, we focus on creating opportunities for that multi-sector dialogue and exchange of information. Aim 3 focuses on developing and implementing effective dissemination materials and activities to support the advocacy and inform the policy making. And last, aim 4, document and evaluate the impact of our activities to orient the future efforts. Again, emphasizing that this center is, it's the initial stage of something larger. The core to achieve those aims, the core works independently in some activities, but also in coordination with other components and cores of this center. We convene the Policy and Community Advisory Board as a group, and also individually, we solicit information and feedback from them to inform and guide our work and revise as needed. With the research project, we are already in the process of finding ways to obtain feedback on the research plans and to ensure that the research project fits the needs. In the future, we will be working on identifying ways to disseminate the findings in an effective manner and to develop city-specific tools and materials. With the research capacity building core, we are focusing on identifying research capacity activities that will address the needs and that by the audience. We'll help prepare seminars, workshops, and we are already doing that, and training in core concepts. In the near future, we will be working with that core, providing input on pilot projects. Part of that call, that there may be some projects focused on working with community or policy stakeholders, and in those will be particularly important our work. And then also in the development of policy and media engagement training. Last, with the administrative core, we will be working with monitoring and tracking of all the project's activities, reach and impact broadly, and relying all the feedback and evaluations that we gather from our stakeholders to ensure the inclusion of diverse perspectives. A few words about the Policy and Community Advisory Board. So the participants include policy and community partners from across the Americas to align with the center geographical focus. And on the map here, and you can see the logos of the different organizations that have agreed to or to participate, to have someone representing in this board, and they represent their members from public sectors, intergovernmental agencies, a network of local governments, NGOs. The group will be providing input regarding the local priorities, or is already providing input with respect to the priorities, the data and information needs, the existing capacity and training needs, and in the future will be critical in helping us determining the right materials for dissemination and activities to disseminate our findings. And as I said before, the center works with other cores to incorporate all the feedback and plan the future activities. And I'll end by saying that highlighting our guiding principle is that local communities, organizations, policymakers play a key role in protecting and promoting health equity, and sustainability. And these actors need access to specific, actionable evidence to inform the work. And with that,
Okay, just a few words to wrap up and then we'll open it up. So speaking for a minute to the Drexel audience, and Alistair mentioned this at the beginning, but I just wanted to highlight the connection of this initiative to multiple areas of excellence and opportunity here at Drexel. And so this is really an opportunity for us to come together and really build on existing strengths to kind of take us to the next level. This is an exploratory center, as I mentioned earlier, so our aspiration is to be able to apply for a bigger center next round, and also potentially multiple other grants that could come out of this initiative. So this is the real goal here. We really hope to engage many colleges here at Drexel, several of the deans, Susan Walker, David Brown wrote letters of support. We submitted the center, and I want to thank them. Also Matthew, of course, and Franco, and both lead, you know, the environmental laboratory and also the network that Franco leads, I think are really important to this effort. And I think there are connections to many other units within Drexel. So how can you be engaged? Well, you heard a lot of things already, but I just wanted to highlight a few. There are a number of activities, the webinars, the invited speakers, etc. Apply for the pilot grant, sign up for our newsletter, contact us. I want to introduce a wonderful project manager, Kayla Barna. Do you want to say hello, Kayla?
Hi, everyone.
Who is doing a terrific job pulling all this together. And so we also look forward to your input on other things we could be doing to sort of elevate this work here at Drexel and across the Americas more generally, because as I said, the partnership with our Latin American colleagues is really a very integral and important part. We really believe that the US can learn from Latin America as much as Latin America can learn from the US. And so this is something that we really want to elevate as much or more even. And just to finish up, I just want to thank everybody who has been part of this. There are many folks online who also signed letters of support for us when we were putting this together and agreed to be pilot reviewers or support us in many other ways, be collaborators, even if we were unable to budget them on the grant. And so we just want to thank everybody for their contributions. Many folks are sitting here in the audience, and it's too many to list. And last but not least, I just have to say, you know, when this came up, we only had like 4 weeks to do it, I think, or maybe 6. And we were like, is this crazy? It's crazy. Are we gonna do it? Yes, we are. And we did it, and it's really thrilling to have this initiative here. And so I just want to thank the team who really pulled together. It's a you know, many times people say it's the dream team, but this is really the dream team. So I'm very grateful to everyone for being part of it. So I think we'll open it up, see if you have any questions or suggestions for us, and we're happy to hear them. Yes.
Hi, I'm Maurice Sanchez. I'm a Pantone Scholar with the Center for Public Health at Penn.
Yeah.
So let me ask you a question, 2 questions. So you had a lot of councils, memberships that you were looking for to join. Will that be, I can sign up for a newsletter. Will that be in the newsletter?
I'm sorry?
Will that be in the newsletter?
Yes, in the newsletter, we will publicize all these things. We haven't started the newsletter yet, but yes, absolutely.
And then, so what does this have to do with restorative justice?
Well, I think, what does this have to do with restorative justice?
Yes.
Well, I think there are lots of connections. I'd be interested in your opinions. I think because of how we know climate change is affecting the most, there are clear implications here, I think, for restorative justice. It's just one more example of the inequities that we have in our society, in particular, that are manifested into health inequities. And so part of the focus on equity that we have in the research project is intended to make that very visible so that we can talk about what the implications, what the policy implications of those things really are. So it's very important. Glad you brought it up. Any other comments or my colleagues want to add anything, please? Yeah.
So you mentioned policy and engaging policymakers. What's the thinking around policy development prior to engaging policymakers?
We proposing policies.
Yeah, or even framing the policies.
Yeah. Well, we hope that the work that we'll do, the research work that we'll be doing as part of the center, but also other, you know, related research, will provide motivation for policy and will provide some insights into what kinds of policies might work. In other work at the Urban Health Collaborative, we're doing actual policy evaluation. So for example, as part of the Southwell climate study, we're doing actual simulation of policy impacts. So for example, electrification of bus fleets, what are the implications of that on various environmental and health outcomes, public transportation initiatives. And of course, this, you know, we hope that this exploratory center will lead to more of that work that is also US based.
And if I just may add that, I forgot to mention that I co-lead this center with Katie Invic and Monica Mazariego. So this Monica or Katie, feel free to chime in, but while they want to say something, I'll just say something that I didn't emphasize. That our board initially is going to be very focused on people who work on the health or the public health related, areas that are probably not that aware of all the climate change related outcomes. So it's our part of the idea is like, well, what public health departments, what are the public health departments, what linkages they are doing, or what work they are, or how they're orienting some of their activities on climate change related focus, no? So it's not working necessarily with offices or organizations that are working heavily on climate change related things, but it's more like, okay, working on public health, let's add that climate change, let's make sure that they are having that connection to inform the work or to emphasizing the relevance. Some of the early conversations are like, this is simply, we don't have budgets, the public health department don't have budgets to do climate change related activities, no? And that's, let's demonstrate how this is something that perhaps should change in the future, no? And I don't know, Katie, and Monica, if you want to add.
There are a couple of questions online. The first one is whether there are any opportunities. Dan Epstein is asking, are there any opportunities for Drexel MPH students to be involved as an online student studying epidemiology with a minor in global health? Brice, I don't know if any of those.
I think that MPH students can, could be designing their ILE projects, for example, along the lines of climate related health impacts. I think that would be one, clear way, very concrete, that can be built into their programs. They can certainly also participate in the training activities that we would have, for example, the journal club and webinars and so forth. So yeah, I think there are different ways to get involved.
If you want to join the journal club, it can it's every other monthly on Wednesdays. You can find information on that on the newsletter that will be distributing. But you can find more information on the screen on that, including the learning community and all of that. Another question online, if we want to go there. It's a question in Spanish, but I'll translate it. How many pilot projects do you expect to fund per country, and what will be the duration of those?
The pilot projects have a duration of 12 to 18 months. And we have the pilot projects will run in 3 cycles. The first cycle is this April. The next due date will be July, mid-July, and then late October, I think. And we are in our selection of during the review and selection of proposals, we seek to prioritize or to make sure that we equitably distribute the pilot funds with our partners, as well as across the partners and the institutions. So we don't have a specific number of this many or that many, but it is something that is very important to us, because part of that grant development, in order to have a sustainable research capacity building, grant writing is essential, and so we are keeping that really close to in our minds.
I think Aiden, and then I'll go to Franco.
Sorry, this is a horrible comment, not a question, but
Sure.
to respond to the thing about MPH students,
Yeah.
one thing that I might suggest for consideration is also opportunities for like the APE or practicum. Because I think a lot of students want to work on climate change issues, but there aren't necessarily local public health organizations that are obvious for them to partner with on that work. So one thing to consider as well.
Great idea, thank you, Aiden.
I just want to say, I mean, there's so many sort of growing efforts on campus to think about climate change and laboratory and engineering and there's a collaboration in the medical school right now. Like, I'm really looking forward to seeing how we can sort of build community around this so that people who are alone in some department somewhere in the campus, you know, who are looking for like, how do I get the climate science accessible, you know, as you talked about, could, you know, they may not be working on health issues, but the methodologies and the access and the data sets are similar. So really looking forward to just sort of seeing a community of people here, researchers, students, and others forming around.
Yeah, that's what we're hoping for. I mean, and if we have, for those of us more in the health area, we need the other expertise. That's the whole goal of this, to bring these two worlds together. So. Yeah, online, yeah.
Another question online, also in Spanish. How are you expecting this more of the community engagement core? How are you expecting the ministries of health of countries to accept the results of your research, and especially if they contradict their own data or their own response capacity?
That's an easy one.
Okay, so then my first attempt, so that's part of the reason why, you know, we're starting the engagement very early on, and, you know, very early on in identifying, you know, what are they, you know, what are you working on? And right now, you know, it's early on, so it's like, you know, very focused on, okay, what are your local needs that you have agreed you want to work or you want to expand. So that's one easy way to at least, you know, not get to that point. You know? But it is very, very important, and we don't mean to be confrontational. And some of them in the conversations have been very upfront, like, okay, we have already are using this, so we want to work collaboratively so that, you know, we don't come out with our own thing that contradicts or that it's in conflict with what they communicate, because I think that's where, you know, things start to go and move in different directions, and that's a key objective of our center, and that was repeated over and over, is how we are really wanting to provide the evidence that will inform, you know, policy making and just ensuring, you know, changes happen. So I first, you know, we'll make sure that early on that we build engagement, we build trust, in which we also understand their own perspectives, and we do the best that we can, but it's challenging. I mean,
Yeah.
I'll just add one other thing to Franco. In every single one of the projects we're engaged in, health disparity comes up. Right, so I think the partnership and really kind of linking with your capacity and your expertise in all the projects we're doing, I think is really critical.
Yeah, absolutely. Well, thank you so much for coming, and we look forward to continuing to interact with you, and join us if you can stay for a little reception outside, and we look forward to seeing you again soon. So thank you.
Yeah.
Are you here just like for the day or do you just today?